This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome to Mon Health Talk. I'm Dave Wilson. This morning, our guest from the Mon Health Heart and Vascular Center. He's been on the show a few times, almost, I would say, enough to call him one of our regular guests, Dr. Wissam Gharib. Good morning, Dr. Gharib.
Good morning. How are you?
I'm doing well. We've had you on a few times, so we've talked about your background. So I'm trying to think of something I haven't asked about your background yet. And I'm going to go with, what do you do when you're not at the hospital? Do you do the stereotypical doctor thing, hit the golf course? Tell me that's not true.
I wish I could tell you it was. It's not true. All I do is work. No, I like to spend time with family when we can. We do a lot of traveling when we can down to Florida or back home to where I'm originally from, Lebanon.
Well, how long does it take to get to Lebanon? How long of a flight is that?
Oh, it's about 10 hours in the air, but it takes about, between layovers, about 16 to 18 hours.
That sounds like a long day to get
Yes,
back and forth. Remind folks, where is the Heart and Vascular Center? And I kind of kid, you're a regular. We've had you on a couple of times. But go ahead and remind folks where the Heart and Vascular Center is and exactly what you specialize in.
So I am a interventional cardiologist. I specialize in structural heart and complex interventions. And what I mean by structural heart is normally interventional cardiologists take care of arteries with balloons and stents and the like. The structural aspect of it is we're able to fix or replace valves from a transfemoral approach. So from the groin, we're able to go in, replace a heart valve, or repair a heart valve that's leaking. We're able to, if there's a hole in the heart, we're able to plug it. If there's a patient who has Afib, which we'll talk about here later today, and cannot take blood thinner, we're able to go in and place a device so they can come off the blood thinner.
Go ahead.
Sorry.
Go
and we
ahead.
do all of this. We do all of this in Morgantown at the Mon Health Center, where the Heart Vascular Center is part of Mon Health. We have a clinic right next door, and then actually most of the work that we do is at the hospital.
Being an interventional cardiologist, is that a specialty within the specialty?
Correct. So we you obviously go to med school, you go to residency in internal medicine, which is 3 years. Then you do cardiology, which is another 3 years. Then you do interventional cardiology, which is 1 to 2 years. And then you can sub-specialize in structural heart disease as well.
And you already alluded to it. We're going to talk about Afib today, and in particular, Mon Health being a first in West Virginia on a new trial. But for folks who've probably heard of Afib or atrial fibrillation, what is that, and what might be some symptoms of that?
Yeah, so atrial fibrillation is where your heart kind of goes out of sync, where the upper chamber is no longer listening to the signals from the brain and from the body to tell the heart to beat or to slow down, like when you're asleep or when you're running. The heart goes basically out of sync, and the upper chamber is going at a very high, very erratic rhythm. The lower chamber is trying to keep up and, sometimes can, most of the time cannot. And what you need to do is get that heart rate under control. So we slow it down or we try to put it back in rhythm. But the second part of AFib is that because that irregular beats up in the upper chambers, you can form clots and a little culvert called the appendage. So a clot forms, and then that clot can escape from the culvert and go into the bloodstream, and usually will cause a major stroke or other things like going to a kidney or to a leg and causing a major blood clot embolize.
That irregular rhythm there, is that something that happens for an extended period of time? Could it be just it happened for a few seconds? What should folks look for?
All of that. Usually it starts off with you go in and out of it, and that would be called paroxysmal. Also, you can have permanent or chronic, which you're always in atrial fibrillation. And I'm using those terms. They're not all interchangeable, but they're all the whole gamut of atrial fibrillation. So it could be paroxysmal, where you go in and out like you were suggesting. but the more, but the longer you have it, the more it becomes chronic and permanent AFib.
Mon Health Medical Center has been chosen as the first hospital in West Virginia for the new Champion AF clinical trial. What does that mean?
Yeah, well, I'll be honest with you. We're very excited to be in this trial. This is going to be a landmark trial. What this is right now the standard of care if you have atrial fibrillation and if you have a CHADS-VASc score, which we'll talk about later, but basically it's an international scoring system that says you have AFib, you need to be on blood thinner, and that's the standard of care. This trial is going to look at the Watchman Flex to see if it can be an alternative as a first-line therapy. So you come in with atrial fibrillation right now, you're going to leave my office with a script for a blood thinner. This trial is trying to see if this Watchman Flex can be an alternative to the blood thinner in all comers. Because right now we use it in a very select group of people. This trial is trying to say, is this as good or better than blood thinner? And that's what this trial is.
Let's squeeze in a break here. We'll discuss more about the trial. We'll talk about the Watchman FLX device and what it does as we continue our conversation. We're talking about AFib this morning with Dr. Wissam Gharib, Mon Health Heart and Vascular Center, and this is Mon Health Talk on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Talking to Dr. Wissam Gharib, Mon Health Heart and Vascular Center. This morning we're talking about AFib, Mon Health Medical Center, the first hospital in West Virginia to be part of the Champion AF clinical trial. And before the break, we were talking about that and being part of the trial, Dr. Gharib. So how and what are you going to be measuring as you move forward with this clinical trial?
So we'll see the patients in the clinic that have atrial fibrillation that qualify for the trial, and almost everyone that's on blood thinner does qualify that can take blood thinner. So we see those patients, we randomize them, so half will get into the trial to get the device, the other half will get into the trial to stay on medication, and the ones that are going to get the device will get the device, and then they'll be followed for up to 5 years. So for the next 5 years after this trial has started, which it just started here a few months ago, we'll be measuring any events that occur. So we're looking for people that are on blood thinner, what their bleeding risks are, what other complications they might have. The people in the trial, we'll also look at their bleeding risk, which we expect to be lower since they'll be off of blood thinner. And then we also make sure that they don't have any uptick in stroke risk. Because the whole reason we put blood thinner is to reduce stroke, so we want to make sure that the device does what it's supposed to do. And based on the clinical the clinical data we have now, it does. We just need to be able to prove it.
Now, this isn't the first AFib clinical trial you've conducted at Mon Health, is it?
That is correct. It is not. So we're currently conducting a trial that we started a couple of years ago here called the Option Trial, which is a trial looking at patients that have an AFib ablation. They go in and they were able to isolate that electrical storm that occurs with AFib in order to put people back into a normal rhythm. And in those people, what this trial does is you do the ablation, then you bring them in and place a Watchman device in them. Half will get the device, half will stay on drug, and we track those people out. So that one is a more select group. These are people that have had an ablation because no one really knows what to do with those people. You come in, you have AFib, you get an ablation, you're now back in rhythm, and the question is, do you need blood thinner for the rest of your life? And we don't really know, so we keep everybody on blood thinner because we're concerned, what if they convert back to AFib and we don't know it? So for now, everybody keeps them on blood thinner. And the Option Trial is trying to say, do they really need it? Can we put a device in them and get them off of blood thinner?
We've mentioned the Watchman device a couple of times this morning, and I remember you coming on previous episodes and talking about the device. But what is the Watchman device, and what does it do?
So it's a small nitinol frame with a covering that promotes it to endothelialize. So it looks like a parachute but the bottom part where the human would be holding onto the parachute is actually enclosed. So what this device does is with atrial fibrillation, you have that little appendage, which is that little culvert that I was talking about. You go in, you measure it with an echo, then you measure by taking a picture inside of it, and then we place this little nitinol frame on the inside of the appendage, and we oversize it because we want it to basically be stable inside the appendage. And then it has these tiny little tines that hold it in place. So you go in and you put this device. When now you're looking at the appendage, all you'll see is that cloth covering, and the rest of the nitinol frame is on the inside. Over the next 30 to 60 days, we keep them on blood thinner, and then it'll endothelialize. So the same lining that lines up the insides of our vessels will actually line this Watchman device so that you no longer have blood going in or out of this appendage. And thus you reduce the chance of stroke, because somewhere between 90 and 99% of all strokes that occur with AFib come from that appendage.
So why is the Watchman device an important alternative to blood thinners if blood thinners have historically worked well?
Exactly. That is a great question. So they do work well. The problem is they don't work well for very long. And the reason being is if you look at people with atrial fibrillation, as we get older, atrial fibrillation increases. If you looked at 80-year-olds, up to 10% have AFib. Unfortunately, with age comes instability. You're unsteady on your feet, you have falls, you're on other blood thinners for other reasons of the heart or strokes, etc. And then you also have problems being on blood thinner for a long time with bleeding. So GI bleeds, falls with bleeds into your brain or other trauma, being on multiple blood thinners causing a lot of excessive bruising, minor cuts cause bleed. So long term, most people can't tolerate blood thinner. And if you actually looked at the data, about a third of people at 2 years are not able to take a blood thinner, and they are switched to something else. So up front, it looks good and it does work, but long term, there's a lot of added side effects and problems, most specifically the bleeding and the falling.
We're talking about AFib this morning and Mon Health Medical Center's new Champion AF clinical trial. Our guest is Dr. Wissam Gharib, and we'll continue our conversation in a moment.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
We're talking to Dr. Wissam Gharib, Mon Health Heart and Vascular Center. We've been discussing the Champion AF clinical trial. Dr. Gharib, who will be eligible for the trial?
So any patient, by the books, it's CHA2DS2-VASc 2 for men, CHA2DS2-VASc 3 for women. But what that basically means is any patient who right now has AFib and needs to be on a blood thinner, that we recommend that they be on a blood thinner, and can take blood thinner, qualifies. That's the lowdown, basically. We actually obviously have a long list that we go through to confirm, because it's very stringent. As with any clinical trial, they're very stringent. We got to make sure we cross our T's and dot our I's. But any patient that needs to be on a blood thinner and can take a blood thinner pretty much qualifies for the trial.
And you've mentioned this kind of international score. Can you explain that in kind of general terms?
Yeah, so basically it takes into account what your additional risk factors are with AFib that puts you at an increased risk for stroke. So you're looking at a person's age, you're looking whether they have heart failure, you're looking whether they have high blood pressure, whether they've had a previous stroke, and you take all those things into account, and each one gets a numerical number. You add those numbers together, and if they reach 2 for men and 3 for women, then they are at an increased risk of stroke, where now the risk of stroke is higher than the risk of bleed. Because with everything we do, we're looking at risk and benefit. So if a 30-year-old or a 40-year-old man comes in and doesn't have any other medical issues and has atrial fibrillation, we don't put that person on a blood thinner, because their risk of bleed with a blood thinner would be much higher than their risk of stroke, so we don't treat them with a blood thinner. we may treat them with aspirin or something like that. But as your risk increases of stroke, now the risk of bleed becomes less and the risk of stroke becomes more. So then we say, you need to be on a blood thinner.
Got a couple of minutes left. What does it mean for the Mon Health Heart and Vascular Center to be included in this trial?
Yeah, I mean, this is where you're actually talking about the real meat of the matter. A lot of people can say, we're the best, we're really good at this, or we're really good at that. And that's great, and we can all advertise and everybody can do that. But when you get recognized, when companies that are multinational, when device companies that are doing these kinds of trials all over the world at the most premier centers come to you and say, we want you to be in this trial, that's a real honor. It tells you you've been recognized for the work that you're doing, and that you're doing work that's second to none. And that's what we try to do here at Mon. Everything that we do at the Heart and Vascular Center, we want to do it second to none. If we can't do it, then we want to send you to the place that can do it second to none. So when we do a Watchman device in a patient right now, we're doing it as good or better than anyone else in the world. And that's what we hope to do across the gamut of everything that we touch. And like I said, from a Watchman perspective, we're a very high-volume center, but also a high-safety center. So we're able to do these procedures, do them well, do them safe, and that's been recognized. And that's when these companies are able to come to us and say, look, we want you to do this trial, because they want to do it in experienced hands to make sure that it's not the doctor that's causing a problem with this particular device. They want to make sure in a place that does it well and does it right, now can we compare apples to apples.
Of course, you can always get more information at monhealth.com/heart. And again, we emphasize this each and every week. Maybe you've put off getting an appointment because of the pandemic. Maybe you've tried to wait it out. Get it checked out ASAP, as always. Dr. Gharib, thank you for stopping by today. Appreciate it, and good luck with the trial.
Thank you very much. Thanks for having me.
Anytime. Of course, more information at monhealth.com/heart.